I became the most difficult patient in the world. But the hard part was to realize that I said no to treatments that in the past I would have had recommended to patients. Doctors have lost sight of the original purpose of medicine. It was supposed to be all about helping the patient feel better, making the patient heal. Now the whole center is make sure they don't sue me, and let's make sure we make profit. And then the other part, the patients, not their fault, out of a lack of education and knowledge, becoming passive, accepting everything the doctors are saying. And even worse, sometimes accepting what non-doctors are saying. I thought I have done everything right regarding my health, and yet I got cancer. My theory, I had allowed my system, my life, my energy field, my biology to be poisoned by grief, by the cognitive dissonance of the place where I was working, by fear, and that knocked off balance my immune system, my DNA, my defenses. Second, there is a huge disconnect between conventional medicine and what the patient needs. There is a huge need for the patients to take control of their health journeys. And I had to learn that after a diagnosis. But I am encouraging people to learn that way ahead of time. To make this about preserving wellness, not about stopping disease. I was convinced that, and my patients seem to prove it over and over, that when a patient had a reason to be alive, when they were happy, when they were staying away from self-pity, when the people around them were being loving and kind, those patients did better and better than the averages and the statistics said they were supposed to do. In fact, my first oncology clinics, I decorated it with clouds on the lamps. I decorated everything like a beach with fake palm trees and funny signs. We called the chemo room the cocktail lounge. We had signs pointing to the chemo room saying this way to the beach. And every examination room had cartoons of comics, laughing jokes about doctors, making fun of doctors and hospitals. My staff was trained to always greet the patients by name and ask about their children and grandchildren and dogs and pets. My staff used to sneak candy to the patients behind my back just to make them smile. Everything they did was to make the patient smile. And over, I heard the stories of patients who had transferred from another cancer center where they used to have horrible side effects from chemo. And now, after transferring to us, the side effects had gone away completely. Wow. And I heard story after story of patients doing better, saying they were leaving my office feeling better than they came in, even despite the treatment, before the treatment, just by the love of people around. And I'll never be able to prove it. I didn't keep those records. I didn't make an official research out of it. But my patients traditionally responded a lot more than what my medical textbooks were saying the patients were going to do. So, long explanation to say, I started my career in oncology with this love, this joy, and this unfinished business of trying to do everything possible to undo what I couldn't help, to help someone because I couldn't help my mother. And then the realities of medicine started hitting me. The first shock was one day when an accountant took me apart and said, "You are making half as much money as your partner." And I said, "Wait, that's impossible. We see almost the same number of patients." And he showed me the numbers and explained, "Yes, but he gives more chemotherapy than you do." And that shocked me because for the first time in my life, it sank in me that what made money to the practice was the chemotherapy, the hand holding, the loving patients, the organizing Christmas parties, everything we did to make the patients and their families feel a little better was not reimbursed by Medicare. And then I started having an icky sense of cognitive dissonance when I was on call and I found 86-year-old patients who should have been on hospice a long time ago, still receiving chemotherapy by some of my colleagues. And that icky sensation of this is not about what's best for the patient, even if they could pass a lie detector that that's not why, they are doing it because they have been pressured by the system that chemotherapy is the only financial alternative for the practice. That if your practice is going to survive, you need to give a lot of chemo. So my disappointment for medicine against oncology and indirectly against the whole of medicine started lurking. The system had forgotten about anything but malpractice, lawsuit protection, and profit. If there was some energy left after that, then you would think about what was best for the patient. I started a support group for physicians, for women physicians in town, and the stories were hitting me. It was a problem all over the place. You wanted to do what was best for your patient, but you had to see 30 patients in a clinic, and you could not devote more than 5-7 minutes to them because then you had a bunch of charts, documentation, and notes to write. The whole system was away from its original purpose, which was helping the patient feel better. And then at that time, I was diagnosed with cancer. Because I knew my mother had that history of incurable cancer at age 47, I had been neurotic about my health. The first thing I did after my diagnosis was that I ordered every genetic testing possible in the world, and it was completely negative. I had 0 cancer genes. I had spent my life, I had never smoked, I have never drunk, I had never touched a drug. I had been neurotic about my weight, keeping my weight healthy. I had stayed away from fats, which was what my medical training at the time had told me was the worst thing in the world. I had even recently started exercising, doing stress management. I had gone to therapy, something in my family would have never allowed, and yet I had done it. I thought I was doing everything right. Then where on earth had this cancer come from? So becoming a cancer patient was a humbling lesson. First, understanding that so much of the advice I was giving my patients, because I was taught to do that in my training, didn't take into account the individual needs of the person. It didn't really acknowledge that the person receiving the treatment was actually the one dealing with the future consequences and should be the person taking charge. It was an eye opener from, gosh, dealing with insurances, dealing with weight lines, even with my pool. I had pools all over town. I was a doctor. I knew the direct number of everybody, and yet that didn't spare the ridiculous wait of weeks and weeks waiting for an MRI, waiting for an insurance approval, waiting for my doctor to be available for surgery. So first, it brought me some humility and compassion for my patients that hadn't realized how hard they have it. Second, it really faced me with the disconnect between what the doctor recommends and what the patient, as an individual being, needs. Give an example. I ended up, doctors can never have the easy case. I ended up with a surprise finding in my surgery. There was a skin lesion very far away from the original cancer, that tested positive for cancer. So the first thought was, well, that means your cancer spread. You are stage 4. You are incurable now. We should do everything just for palliative treatment, symptoms control. When at the deep, I had the advantage of being an oncologist. I knew something doesn't compute here. How can a cancer that was early stage be spread? I had to defy my doctors, go do my own research, dig into my family history to find the piece of information that connected the dots. Wait a minute, my grandma had a history of accessory breast tissue. There was a little piece of breast tissue that was out of place there for her. Maybe I had something like that. Let's test this. Anyway, for the next few months, I had to fight for my life to avoid doctors labeling me as incurable, and then to avoid doctors, to prevent doctors from killing me with the treatment. I had 3 surgeries in 2 weeks, trying to get rid of this second surprise cancer we have found. And there was my case was represented in the local oncology meeting, and all my colleagues in the world knew what was happening and were giving their opinions. Some kept saying, we need more surgeries. We need to go back there and have a 4th surgery and get all your lymph nodes out. Some of them were saying, we need to get your ovaries out, your uterus too. You need to get everything out and get rid of any hormones in your body. The radiation doctors wanted to give me huge radiation fields. And I had to sit. When I was a doctor, I would have said, well, the expert says that, let's do that. I had to fight with tooth and nail, go back to the table, do my own research, and start telling people, do you realize it's me who's going to spend the rest of her life with the consequences of this treatment? Even for the time of chemo, I could already feel the changes in my body. Fight and said, no, you said there's a 1%, 2% benefit of doing that. I am not doing it. No, thank you. I'm doing the tamoxifen instead and keeping my hormones for a little longer. You say I have to have this huge radiation field. I say, no, thank you. I'm not going to give radiation to my heart. You are only going to radiate the place where the second tumor was found. I became the most difficult patient in the world. But the hard part was to realize that I said no to treatments that in the past I would have recommended to patients. Refusing a port because I didn't want an extra scar, to refusing adriamycin chemo because for the first time I understood living for the rest of your life with the question, did it damage my heart? Is it going to give me leukemia in the future? So that became another brick on the foundation of understanding what's missing in healthcare. Doctors have lost sight of the original purpose of medicine. It was supposed to be all about helping the patient feel better, making the patient heal. Now the whole center is make sure they don't sue me, and let's make sure we make profit. And then the other part, the patients, not their fault, out of a lack of education and knowledge, becoming passive, accepting everything the doctors are saying. And even worse, sometimes accepting what non-doctors are saying, because I have plenty of friends sending me messages about very to the point treatments like plant-based nutrition and other things that may or may not have been that safe to do. So that was the need to empower patients with education and to open the mind of physicians to understand what their patients are going through, which I admit it is difficult because in order to do the work an oncology does, you really have to create a barrier and not let the suffering of the patient gets you. That's what I was unable to do. I'm an empath, and I believe that contributed to my health decline. Anyway, on February 2020, I presented my resignation. The COVID pandemics hit shortly after that. and using the excuse that, not real excuse, it was true, that my recent chemotherapy treatment made me immunosuppressed and more likely to be susceptible to bad consequences if I did catch COVID in the hospital. I asked them to release me from the 12-week notice, and they agreed. My last day of work was April 2, 2020. I stepped in my office, picked up the few loving memories of gifts my patients have given them, took pictures of all the little postcards and loving messages I had there, threw away all the old journals, all the old books, and walk out of there forever. I've never set a foot in that office again. It's a long story. Yes, I've been in all three sides. I've been a caregiver as the loved one of a patient with facing not only cancer, any scary, life-threatening chronic illness. I've been a physician, a provider, and I've been a patient receiving the treatment. And from all this journey, to summarize what I learned was, first, there is a lot we still don't know about what causes cancer and illnesses. I thought I have done everything right regarding my health, and yet I got cancer. My theory, I had allowed my system, my life, my energy field, my biology to be poisoned by grief, by the cognitive dissonance of the place where I was working, by fear, and that knocked off balance my immune system, my DNA, my defenses. Second, there is a huge disconnect between conventional medicine and what the patient needs. Third, there is a huge need for the patients to take control of their health journeys. And I had to learn that after a diagnosis, but I am encouraging people to learn that way ahead of time, to make this about preserving wellness, not about stopping disease.